Hi everybody, Dr. Katie Brown, the CFS doc here, and today I wanted to talk to you about the connection between chronic fatigue syndrome and excessive urination. This was a strange symptom that I noticed in my own case, but I didn't realize at the time that it was actually a known symptom of chronic fatigue syndrome. I haven't been able to find a perfect explanation as to why this happens. It probably has something to do with a dysregulation of the HPA axis, which is the connection between the brain, the hypothalamus part of the brain, the pituitary gland part of the brain, and the adrenal gland, which sits on top of your kidneys and releases stress hormones and also hormones that help regulate the concentration of urine in the kidneys. We do know that people with chronic fatigue syndrome actually have lower blood volumes than healthy controls on scientific studies. And so there is this wasting of water. We tend to be thirsty, we tend to feel dehydrated, but oftentimes we find that even if we try and drink lots of water, we're peeing it out all the time, and it's frustrating, especially when all you want to do is lay down and rest, and you're having to get up and use the bathroom all the time. So this low blood volume actually leads to one of the primary symptoms of chronic fatigue syndrome, and this is part of the diagnostic criteria, and that is orthostatic intolerance. That means simply that when you're in an upright position, your body has difficulty getting blood all the way to your brain. Your body has trouble fighting gravity and getting that blood flow to your brain. And we know that there's differences in how the heart works, and this is because the blood volume is low. So often what I encourage my patients to do is, if they are feeling unwell, if they're in a flare, or even if they're just pacing and they're wanting to take time to rest during the day, I encourage them to do it lying down. Get your feet up to the same level as your heart. Lay down in bed, lay down on a couch, drink lots of water, even though it's frustrating. Even better, drink water enriched with electrolytes. I've seen mixed results for how well electrolyte supplementation can help. Some people find that even if they're drinking electrolyte supplemented water all day, they are still having really bad orthostatic intolerance. Perhaps they have POTS. They may get IV fluids on a regular basis. Usually, just some supplementation, especially in the morning, can be helpful. And then being aware that your body is less stressed out when your legs are propped up and or your body is completely horizontal. So if you can work from that position, if you can have fun from that position, if you can rest in that position, the more time you can spend in that horizontal position, the less stress you're going to be under, and the less energy your body is going to have to spend trying to get blood to your brain. If you're in the United States and you're looking for a doctor who's familiar with chronic fatigue syndrome, then check out my website in the link below. Otherwise, like, subscribe, and I'll see you in the next one. Bye.